Dr. Horton said I am the executive director of a private nonprofit called Mental Health America of Illinois. We actually celebrated our 100-year anniversary last year, so it's very exciting that we have spent over 100 years. Jane Addams was one of our founders as well, so it's really exciting to have an organization who is still rolling after 100 years of service in the state. There actually were quite a few organizations that Jane Addams and lots of her other social justice colleagues and friends helped to found in Illinois 100 years ago, and so we're lucky to be amongst those. I think a lot of people are really surprised to know how much it really does impact our everyday lives and the people around us. We're also going to talk about some barriers to integrating physical and mental health care. For our history, it's really been separate. We've thought of our physical health care differently than our mental health care, and really our brain is the most important part of our body. It's what makes it function, and mental illnesses are brain disorders. And so I don't know how things got separated out so long ago, but we need to start bringing it together and really thinking holistically about our physical health care, including our mental health care. We're going to talk about a few good recommendations for integration, and then talk about some other opportunities, things that are already going on, some public awareness campaigns, some things that possibly you all might be able to feel like you can have an impact in and get involved in. Surprisingly, children are really a population that suffers a lot. 1 in 10 children under the age of 19 have a serious emotional disturbance. That's about 350,000 children. The sad thing about children is even less children than adults actually wind up getting treatment. So only about 30% of children ages through 19 are actually receiving treatment. And so there's high rates of comorbidity with other physical illnesses. Persons with serious mental illnesses die on average 25 years earlier than the general population. Uninsurable. And so therefore, they actually have a hard time even accessing mental health care. And they may get their mental health care, but they're not accessing health care. And this is one of the reasons that integration of overall health care and mental health care is so vital. Collaborators between mental health professionals, mental health settings, and other physical communities. The criminal justice and the juvenile justice system. We see way too many people housed in our justice system. They've become our new mental institutions. So while deinstitutionalization happened in the 50s and 60s, and we stopped just locking people up and throwing away the key, instead we've now begun to criminalize them and put them in our criminal justice and juvenile justice system. So Cook County Jail is the #1 housing authority for persons with chronic mental illnesses in the state of Illinois. That's not supposed to be the case. Success rates should go nowhere but up. I mean, hopefully one day we'll be able to really pinpoint, do lots of different prevention activities that will hopefully prevent people from even having symptoms, or right at the onset of symptoms, really be able to treat that and be able to prevent some of those long-term impacts that we just talked about, particularly other illnesses that may become comorbid.